on number 2, but you're really assessing the skin throughout the whole thing. So you can comment on the skin with every part that you do, or you can kind of wait till the end and clump it all together at the end, just as long as we know that you're assessing the skin. So whenever I checked her temporomandibular joint, I was feeling of her skin. Whenever I checked her neck and was feeling of her trachea, I was assessing her skin there. So you don't have to comment on everything. It's okay to say at the very end, I've been assessing her skin. Her skin is warm. Hers is probably dry because she's really dehydrated, as evidenced by her cracked lips. And her constant itching. Okay, so now on to cervical lymph nodes. So it's been a little bit since we talked about cervical lymph nodes. But make sure in your book, it's on page 58. So mark that in your book. Lymph nodes.
Lymph nodes 38?
58.
All right, so lymph nodes. Pre-auricular means above, in front of the ear.
Oh, you have the new book.
56. They're on your page.
There's a diagram in there somewhere. Even.
Yeah, we do. So did you find it?
Yes. So 54 for the new people.
54 for the new book. We all have different versions.
The newest one is 54. This semester is 54.
Pre-auricular in front of the ear. Pre-auricular, post-auricular. Occipital, kind of towards the back. It's not directly in the back. It's kind of like on the side, but it's on the back of the head. Pre-auricular, post-auricular, occipital. Submandibular, submental. Jugulogygastric is where the earrings are, your dangly earrings are going to hit. Jugulogygastric. There's 3 in the neck. Superficial cervical, it's kind of more towards the front. Superficial cervical. Posterior cervical means back. Posterior cervical. Deep cervical chains kind of in the middle of those, and those run all the way down the neck. So deep cervical chain, all the way down. Supraclavicular. Now here I would go ahead and assess her epitrochlear. Okay? So make sure you're saying those out loud whenever you're practicing, because those can be a little bit tricky. Any questions on those? And the more you do them, the more it just gets into a routine. So next we move, now I'm going to move on down to her chest. So we're looking at the symmetry of her chest and configuration. Everybody know what chest configuration is? Chest configuration is where I'm looking at her, what's the word?
Anterior, posterior.
Anterior, posterior. So I'm looking at this against transverse. And it should be a 1:2 ratio. So you see that's this big, and this should be 2 of those. So chest configuration is anterior, posterior to transverse, and it should be a 1:2 ratio.
So what you could get in there if you have abnormalities like kyphosis or lordosis, or your barrel chesting, or even your pigeon chesting. We talked about those, I think, with respiratory assessment. So those would be abnormal configurations. 1 to 2.
If you did this verse, it'd be 1, 2. Yeah. Say I'm checking chest configuration, go through the movements. It's a 1:2 ratio. Then we have symmetrical expansion, and everybody remember that? Symmetrical expansion is where I'm going to come to her back and I'm going to put my hands, what do you call it, a butterfly? A butterfly? My hands, and I'm going to say, take a deep breath in. And my hands should move symmetrically. Okay, symmetrical expansion.
That's basically where you follow the rib cages. Put your hands at the base of the rib cage on each side of the spine. So when they inhale, your hand should go like that. If you see asymmetry, then you've got something going on then with that lung that didn't move. Posterior is better. You can test it anterior, but I think, especially on women, that's going to be, I think, a little bit more difficult. I think you'll just get a more true result if you do it posterior.
We're okay just doing that.
Okay, yeah, posterior is what we will ask you to do.
And then also on this is masses and tenderness. So after I've, felt around right there, I can say there were no masses and she didn't have any tenderness. We've already done the spinous process whenever we had them at the beginning and had them to bend over and we checked their spine. Okay. Breath sounds. So breath sounds are a critical area. So how many spots do I have in the front with breath sounds? 5. And I don't think that you have a picture.
It's on 122 in the old Jarvis shows the posterior. It doesn't show the anterior, the 5 anterior. But it
I think
shows
the
9.
anteriors are in your textbooks though. In the respiratory assessment chapter, I think it shows both anterior and posterior in your textbook.
Okay, so with anterior, it starts right underneath their clavicle, and there's, like we said, there's 5 locations. So, and we want you to say it, like we want you to go through the movements. 1, 1, 2, 2, 3, 3. And on 4, you have to displace the breast. Displace the breast. 4, 4, and then 5 is up underneath. 5, 5.
Not all are going to be that easy, okay?
That's what I was saying. I told Wendy, I said, if anybody tries to displace my breast today, they are tight, packing their tight with this sports bra. Like, they're not moving. It'd be rough. So, but at the same time, and like what you can do is you can say, verbalize, like I just verbalized my 5 locations, and then I can actually listen. Okay? Or you can listen while you're doing it. You see what I'm saying? So you can actually just go through the movements if you want to at first, and then actually take a minute and listen and tell me what you hear. Okay? No adventitious lung sounds noted. So on the back, we'll just stand. So on the back, we have 9. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7. Then on 8, I come out on 8, 8, and then I come back down on 9, 9. Now you see how I'm moving my finger? That kind of helps to know exactly where I'm at. 3, 3. You see how I'm moving my finger with it? Now, should I be like down here? Sometimes we make these big movements and we get way down here. What am I assessing way down here?
You should still be on your rib cage.
You think about your rib cage protects your lungs. So your lungs are going to be underneath your rib cage. So if you're way below your rib cage, you're assessing the kidney clamp.
You shouldn't be down here. Assessing lung sounds. You're way down there.
And one thing that
No, I'm just making sure that I come back to the same spot when I do my finger.
And one thing I always try to remember to kind of keep you in line, you should be at 5, you should be hitting the bra strap. Okay, you should be about right there. So that way you're kind of keeping in line. Okay?
For time's sake, no. If you show me the movements and then take a second and truly listen, have them to breathe in and truly listen just at a couple of quadrants and tell me what you hear. But for time's sake, now in actuality, you would do that. But for time's sake, we're not going to do that because that would be a lot of the time. That'd be your whole time. So just take a minute and truly listen and do that tempo here. Does that make sense? Now, how many doctors do you see that do that every time they go into a patient's room? Me and Jessica, we were outside a patient's room in clinicals, and this is what the doctor did. The patient was in a wheelchair outside of the patient's room. The doctor did this. How are you doing today? Good. Good. I'm going to get that lab work drawn. That was a good assessment. Okay, so breath sounds, describing what you hear is critical. And then we do the heart sounds. Really 15 should probably be above 14 because you're going to do your heart sounds first. Okay, so my heart sounds, make sure that you understand the landmarks because we want to hear you say the landmarks. So on the second intercostal space, you know that an intercostal space is between the ribs. Okay, so second intercostal space on the right side, that's her right side, is aortic. Second intercostal space on the left side is pulmonic. Erb's point is going to be third intercostal space on the left side. Tricuspid is going to be left lower sternal border. So the sternum, right on the lower side of the sternum on the left side is tricuspid. And then mitral is going to be fifth intercostal space, mid-clavicular line. Mid-clavicular line says in the middle of her clavicle, go down 5 intercostal spaces, and really it's right up underneath her boob is the mitral valve. And this is where you're going to listen to her aortic, her apical pulse for 1 full minute. Okay? Yes, yes, yes. Yes, I'm sorry. Okay, so second intercostal space on the right side is aortic. Second intercostal space on the left side is pulmonic. The third intercostal space on the left side is Erb's point. Left lower sternal border is tricuspid. Fifth intercostal space, mid-clavicular line, right up underneath here, is her mitral. So really they kind of flow. Second, on the left side, it's second, third, fourth, fifth. The way I remember it, aortic, pulmonic, I always think of anatomy and physiology, A and P. So I do A first, P. And then Erb's point's the weird one. We all know mitral is the main one. Okay.
So if you have a patient that has a pacemaker and you're hearing that, I mean, how would you know that for a second? Just that
Just exactly what you hear. You know, don't get away from saying normal, even though it may be normal for that patient. Just say exactly what you hear. So while you're listening, also, but she brought up a good point. You have to say, so the landmarks, you have to, with the landmarks, you're going to hit the apical pulse location, but you're also got to make mention about the rate and the rhythm, which you're going to say, her heart rate was 89. The rhythm was normal. The rhythm was normal. No rhythm. Yeah, rhythm was regular. No murmurs noted. Yeah. 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 Like I said, the more you practice that, the more you can just spit that out. And like I said, this one's second, and then this one's third, fourth, fifth. All right. Any questions there?
Yes. It'll be probably in the chest. Probably gives
And
it-
I also
gives her a heart
gave you,
chakra.
I also gave you the handouts when I did it in lab. You have the handouts of the heart sound.
This one, so does anybody have the page on that?
Are you talking
Oh,
about the heart sound?
yeah, the heart sounds are 139.
In the old book?
In the old book, it doesn't say Erb's point,
No, it doesn't.
but Erb's point is just, Yeah, oh, I'm saying like in the writing,
Yeah.
in the writing where it's talking about like the anatomical locations, it doesn't say Erbs Point. But Erbs Point's fourth
But
intercostal
it does
space.
on my handout that I gave you, it's in there, I've got it. And also with the tricuspid, you know, in here it says the left lower sternal border, but it's also written as, make sure I get it right, as the fourth or fifth intercostal space too. So you can say either one, because it's the same area, they're just using the numbers. So some books you'll see it that way, some books you'll see it just saying the lower sternal border.
Okay, any more questions?
Third.
All right, so now, let's see, where are we? So we've done, okay, so those are critical, and those locations are critical, so make sure you practice your locations. And more than likely, you are going to get a female patient, but you've got to, anybody who gets Michael and Matt and Colin are just going to be, men are so much easier, you know? Yeah. Yeah, so see, that's why it's nice to have them do all that, everything that they have to do while they're standing up. No, nothing's been laying down yet. So now I'm going to go to her upper extremities. I've already done a whole lot of this whenever I had her up. So I'm looking at symmetry. I'm looking to see if her arms are symmetrical. I'm feeling of her skin. And like I said, you can comment right now on the skin if it's warm, if it's dry. I've already done fine motor. I've already done range of motion, muscle strength. So what I have to do here, and I've already done her epitrochlear lymph nodes. So really the only thing left here is sensory, where she has to tell me if she feels pain or a light touch. So I'm going to say, can you close your eyes and tell me if you feel a light touch or if you feel pain? And then we'll stick her pain. And then, of course, I would do that on her actual skin. So that's sensory, and then I have to do her reflexes. So we're not going to go over these in detail because we did it at the lab, but Amanda Claus has reflexes, amazing. So I'm going to check her brachial. Then, oh, there it went. Can you feel it?
No, I don't.
Oh, I can feel it. Okay, so there's the brachial. And I'm kind of behind everybody, but triceps reflex. I'm not going to hit her. What is this? Radialis. Brachial radialis. So there's her upper extremities. What should reflexes be? Reflexes should be about 2+. Find that in the book and mark it. At this time, what's left is the pulses. Some people clump all of the pulses together because the pulses are a critical component. So sometimes they kind of clump them all together. It's just, again, however you decide to do. I've already done the temporal. I've done the carotid. 209 is grading the reflexes. Just hold your hand. Brachial pulse, radial pulse. Those are 2+, and I would check that bilaterally. So now I'm going to go ahead and move on to the lower extremities. I'm looking for symmetry. I'm looking for edema. I'm looking at if she has hair on her legs, like the males, you would check hair distribution in their legs. So I've got to do sensory. So some people choose to do upper and lower kind of at the same time. They do sensory on both upper and lower at the same time. They do reflexes at the same time, and they do pulses at the same time. So it's really, again, dependent upon you. So again, you would just rub this on their lower skin to say, tell me if you feel light or pain. Reflexes. Remember, upper reflexes, we use the pointy end of the reflex hammer. The bottom reflexes, we use the flat end.
What happens if we just ask
if you don't elicit any reflexes, that's fine. Just say, I'm unable to elicit her reflexes. As long as you're going through the motions. And like her reflex, I can feel that move. I can feel that with my thumb. So, you know, somebody checking you off is not necessarily going to see if you elicit those reflexes. And her reflex is just maybe a 1+. So say that. You don't have to verbalize everything as are normal. Not everything's going to be normal. So like her that one would probably be a 1+. No, nobody's going to be like Amanda. Anybody who gets Amanda is going to have a lucky day on reflexes. So quadricep reflex, I'm going to hit right below their kneecap, and they should, Amanda would kick me in the head. The Achilles reflex, remember you're hitting on the back. Now the response on Achilles is that they're going to push in like a gas pedal. We tell people that are checking off, like the people that are the patients, that they don't have to take their shoes off. So just go through the motions here, because we told them they didn't have to take their shoes off. So I'm hitting, and just say the normal reflex would be her pushing down on my hand, and it should be a 2+. And then Babinski's. Babinski's where you're making the J. Remember that the J goes toward the toe, the big toe. So I did it. And what should the patient do? The patient. Okay. So what if they flare their toes? Okay. Good. So I've checked sensory. I've checked reflexes. Now I've got to check pulses in her lower extremity. So popliteal pulse is right where the knee bends, just right in the middle, popliteal pulse. And try to find yours. Popliteal, again, is one that's hard to find. So I'm just going to say, I can't feel her popliteal pulse right now. I'm going to go ahead and assess her dorsalis pedis, which is on the top. And then the posterior tibial is inside, right behind that bone.
Because if they have those, you know they have a popliteal.
Okay, dorsalis pedis, posterior tibial. Okay, and I can feel hers. Well, I couldn't on the top one, but I can feel that back one. But like I said, they may have a shoe on. Just say it should be a 2+. But feel your own. Make sure you know where yours are, and then you can feel it on somebody else's. So now's when I'm going to have her to lay down. So now I would have her to lay down. Okay, so when I think I need hair distribution. So when she lays down, I'm going to look at her abdomen. I am looking for symmetry. Contour means, if they have a flat, just for the record, everybody has a flat stomach for checkoffs. Everybody has, except Ms. Lear. Yeah, except Ms. Lear. Symmetry, you're looking at their umbilicus. A good example of umbilicus, I have a niece who always has drainage out of her umbilicus, and that nasty is because she picks at it all the time. Constant picker of the umbilicus. No, that's a different one. Some weird nieces. You're also observant for any pulsations. Now this person, you're not going to pull their shirt up, so you're just say it. I would be looking for any pulsations. What would a pulsation may indicate if you saw pulsations in the abdomen?
Abdominal aortic aneurysm.
Yeah, abdominal aortic aneurysm. They have pulsations. And then I'm going to feel the femoral pulse, and I'm going to feel the inguinal lymph nodes. So femoral pulse and inguinal lymph nodes. We're not going in the pants. We're going outside of the pants at the general location. Don't get too friendly. Like Carmen was my 3rd semester nursing student who had went to her 3rd checkoff and totally put her hand down my pants.
Really?
Yes. You didn't know it?
No.
And it was her 3rd checkoff, so I hated to say anything, and I just sat there and took it. I was so embarrassed. My face was so red. She passed. So after I observe her stomach, so back to abdomen. After I observe her stomach, then I'm going to listen to bowel sounds. It's important that you're not pushing or anything on their stomach before you listen to bowel sounds, right? Remember, because if you push and stuff on their stomach, then it can make them have false bowel sounds. So what quadrant do we listen to first? Right, lower quadrant. So listen to all 4 quadrants of the bowel. What if you do not hear bowel sounds? How long do you listen? You listen for 5 minutes. So you could be listening for a total of 5 minutes in each quadrant. Most people are going to have bowel sounds. If you don't hear bowel sounds on somebody, which you are going to, I mean, don't sit there and listen for forever during this checkup. We are kind of on a time constraint. But, okay. I think, is that it? Yep.
Do what?
Yeah, that's another word for like the upside down J on the yeah. Patellar reflex. It don't matter. Yep, that's fine. They run right up here. Epitrochlear. The epitrochlear lymph nodes. I would clump them all here. With the cervical lymph nodes, I would do, all these, supraclavicular, and I'm going to go ahead and assess her epitrochlear nodes. Just a group of lymph nodes that run up your arm.
In inguinal, does it just run right along that crease?
Yeah. It's right there with the femoral pulse.
Right kind of with the
Yeah, just kind of right there where the leg bends. So like this is my pulse, and then my lymph nodes would run like up here.
Okay, quick question. The documentary that's due, is that due tomorrow, or is it due next week? Because some people, I guess, it says it's due tomorrow.
It's due tomorrow. I mean, it should not be a big deal. It should not take you. Yeah, I mean, you're going to do the assessment today in lab, and then you're going to go home and just kind of document exactly, what's on here that you assessed.
So that paper tells us exactly what to put on our documentary.
What you're putting on your documentary is like you would do a head to toe assessment. Yeah,
It's only the assessment tab.
This paper is a little bit more detailed, but we wanted you to have something to write on.
And like, for example, some of the things, there's not a checkbox. Like, for example, you're not going to find a checkbox for jugular veins. So some of this stuff you may have to do a little side note on. But you will do it under the appropriate section. Like, jugular vein assessment would go under the cardio assessment. If there's not a checkbox for it, which I don't think there is for jugular veins, you would just do a little side note that said, no jugular vein distension noted. Okay? The same thing with like the chest expansion. There's not a checkbox there for that. So you're just gonna put a little side note that chest expansion was normal. I don't think there's a thing to check for configuration. So you'll put a little side note, for there.
And I mean, you use it wisely. It's not an assignment. You're studying for this checkoff. Yes.
But the other thing too with making you go into DocuCare is that it's helping you learn how to appropriately describe things. So that when you do come into checkoff, you would be able more appropriately to describe, other than, yeah, it good. It's good. Yeah, exactly.
Oh, y'all should have told me that. All right.
No,
The what?
the, yeah, I can't even think of it now. They do where you put a similar object that they can feel in their hand.
Oh, okay.
It's in with the neuro but we're not going that deep into it.
I'm gonna call Kay real quick so we go ahead and do that.
Okay.